Honourable member for Calgary-Fish Creek, followed by Calgary-Glenmore.
Thank you, Mr. Speaker. Albertans are tired of watching this government mismanage our health care system. First, it was the centralization of home care services that saw our seniors suffer as the government shook the system upside down. Now the government has been caught dead in its tracks trying to centralize lab services, despite pathologists warning that it will result in patients waiting longer for care. Considering this government's record on long wait times for patients, can the health minister explain why this government bulldozed ahead with this plan before listening to the experts?
Well, Mr. Speaker, as I was very pleased to state in answer to an earlier question, I consulted with Alberta Health Services today, and I was reassured to know that the overwhelming majority of the 90 pathologists who work in that organization do support state-of-the-art lab services for their constituents. I can only wonder, Mr. Speaker, why this honourable member apparently does not.
Honourable member.
Thank you, Mr. Speaker. Since CEO Duncan Campbell took the time to tweet that they will now be holding consultation with physicians and staffs after public backlash, can the health minister tell us why you didn't listen or consult with the pathologists first?
Well, Mr. Speaker, the honourable member has her information wrong again. Consultations on this initiative have been going on for quite some time, Mr. Speaker, and that is perhaps part of the reason that the opposition raised this matter first when the House reconvened last week. We have absolutely no problem, Mr. Speaker, talking about the importance of this initiative, about the fact that it's a plan to ensure that we can keep up with the 6% per year growth in lab tests, to talk about the fact that it's a plan that will make sure that all of the newest and most sophisticated lab tests will be available to residents of the northern part of the province. Mr. Speaker, this is what responsible governments do, and this is how we move forward to a high-performing healthcare system.
Well, Mr. Speaker, we've heard that story before. There's been no consultation on home care. There's been no consultation on EMS dispatch, no consultation on pharmacy, no consultation on frontline care workers, and it goes on and on. Minister, if you've consulted with pathologists, please table them and tell us who you consulted with.
Well, Mr. Speaker, this honourable member loves to talk about consultation until the point that the majority of people disagree with her and with her party. The fact of the matter, Mr. Speaker, is that I spent the better part of 2 years as Minister of Health consulting with Albertans about initiatives in all these areas, initiatives that have led to significant improvements in our healthcare system, that have resulted in some changes to decisions, Mr. Speaker, that have kept home care providers intact for residents of congregate living facilities, in initiatives that will result in state-of-the-art ground ambulance dispatch for every region of this province. Mr. Speaker, there are many examples of this government working in partnership with Albertans and providers to improve health care.